And so I believe within the article, there was a little bit of discussion about gaps in communication. So I was wondering if you could comment a little bit more about how that comes into play, both pre and post care, and how maybe an integration of a multidisciplinary model or multidisciplinary management of these patients may assist in the level of care that's provided at this point.
So we were talking a little bit about the risk factors for these diseases. And so there are ones that are non-modifiable. We talked about age, but also other risk factors such as the invasiveness of surgery, elective, and also the optimization of the patients before surgery. And this is where we want to raise awareness that the surgeons and anesthesiologists should assess, discuss, and optimize potential risks for each patient. And this has to occur before surgery. So best practice and interventions can start and begin way before the surgery and then extend into the recovery period. And to be most effective, the strategies require family engagement and involvement of this interdisciplinary healthcare teams. One example is the family and support system. If there are concerns, for example, it should be up to the healthcare team, the perioperative team, to refer to a social worker or any care that the patients might need. And then there are simple things like visual aids. Or hearing aids. I remember several years ago, like if you had glasses and hearing aids, just leave them at home. We're going to lose them in the hospital. Now we know that that is not the correct way. It is very important for these patients after surgery so that they know where they are, they understand what's happening around them, to have all of these aids available to them immediately, already in the recovery. When patients after surgery, when they go to the recovery unit, those should be made available, and that seems to have a huge impact in decreasing, for example, delirium. Another very important point that I also wanted to discuss is the adopting healthy lifestyles, such as the one that are recommended by the World Health Organization, such as physical activity, cessation of tobacco, making sure that your blood pressure and your diabetes are well controlled. They have a huge impact. And this is what we discussing about. The care has to start before surgery. If you have time to optimize your patient, your outcomes will be better. They will be better also for the patients and their families.
Absolutely. And just to sort of to wrap things up, I was wondering if you could just give us an overview of what the key takeaways for clinicians would be. I know we were kind of talking about the multidisciplinary care model, how it's kind of crucial to involve pre and post care and understanding of what needs to be accomplished before surgery, probably on the patient's part. But as far as clinicians and those in the field of neurology, what can they do to address this and to make patients more aware of what needs to be known?
And I think we need to start telling our patients that the advances in surgery and anesthesia, they can improve their function and quality of life, especially in the elder patients, because if they need a hip replacement and they can't walk, they cannot have a healthy lifestyle. So identifying the risk factors that can be optimized preoperatively is key at this moment, while we are still trying to untangle all the mechanisms that are behind these diseases. Identifying the risks, patients that are at high risk for developing these conditions, they should trigger immediately an evaluation and optimization.